Craziness that's been going on. So obviously today's panel is going to be support and resources for seniors and those caring for the elderly. And we have the lovely Michelle Gehring, who is also mine and Nicole's boss, to talk about some things that she has experienced. And then we also have the wonderful, the two Joannes, both from Hospice Alliance, correct, to discuss about their expertise as well and their experience. So welcome. If anybody, I mean, I know there's not many of us, if anybody has any questions, you know, usually we've been leaving them till like the end. If there's something, you know, you're afraid you're going to forget, there's always a chat feature at the bottom. If you want to put that in there. Well, it looks like Aaron can't get video to work. Oh, sorry.
I didn't get to work for some reason, sorry.
That's okay. Nicole was having the same problem. The technical difficulties happen, unfortunately.
Yep.
We'll make do. So yeah, so welcome everybody. Thank you for joining, and I will pass it off to the lovely ladies, whoever likes to start. Hopefully Tammy will be joining us too, but we'll just go on and see what happens. All right, I'll leave it to you ladies. I'm gonna mute myself.
We're passing the baton to Joanne Brown.
Oh, okay. We all kind of looked at each other like everybody knew who was supposed to go next. Thank you for having me here tonight. I think this is a really important topic, especially given the unprecedented events of the past couple of months. People have been really saying that, but it's almost like it's just become another term to us. But every day that someone has to live through the day or has to take care of someone who lives through the day, it's more than just an unprecedented day. It's certainly a challenge for even the strongest hearted. When I was thinking about the impact of what's been going on older adults overall, not to mention those who care for older adults, I sort of just kind of started thinking about how I had been experiencing the pandemic, where first you get overwhelmed by information. And at first, all the information that came out was, you know, this is terrible if you're over a certain age. This is terrible if you're over, you know, have certain health conditions or whatever. And talking about, you know, shutting down nursing homes and things like that. All of these things were happening, and they seem to be happening skewed towards people who were older. It was no surprise that anxiety and a sense of vulnerability and everything increased. And I think that older adults are one group that has been very, very sensitized to what's been going on. And what we're now finding out is that other age groups and people of other abilities are also certainly experiencing and carrying the virus. But early on, when all the real information allegedly first came out, persons over a certain age were certainly made to step back and think about things. And so, I mean, I think that the initial anxiety was very understandable. The initial anxiety was very protective, and people did what they did, whether it was being an older adult or caring for an older adult. Everyone did the best that they could to try to protect people, because nobody knew what we were dealing with at the time. I think it heightened in the older adult population. I think it heightened the sense of vulnerability that was already there. And I think that's really hard sometimes to understand. If you're not in a vulnerable group, it's hard to understand the vulnerability. So I just think that there's been a great deal of that going on. And what I've seen is that a lot of times, if the caregiver can develop more of a sense of comfort and calmness. A lot of times the person they're caring for, it kind of washes over them and comes over them. But I think initially the response of anxiety was a perfectly normal, natural response to have. But what everybody has anxiety, what do you do with the anxiety that you have? Well, it got compounded when we were told to stay at home. If you live by yourself or you only have periodic visitors, that can be a very lonely experience, even for someone who says they like to be alone. 24/7 by yourself can be really challenging. And so I think just the circumstances that had to occur created some difficulties for older adults. And now that we've kind of gotten through the really stringent rules that we have had to live by, now it's kind of going more into just a regular flow. But some people are still very anxious about it and feeling very vulnerable. So we've got it down. We understand what to do to protect ourselves because we've been instructed on things to do, and we've seen somewhat of a flattening of the incidence of the disease. Then comes the bigger question, which is, how do you manage these mental health concerns like anxiety, when you feel you can't control things, depression, which occurs when you feel like things are going on in your life and you can't control them, any other kind of mental health concern that arises when you feel really vulnerable. What are some things you can do to try to manage those? There are some really, really basic things. One thing is to stay informed, not fearful, but stay informed from good resources and find out how to protect yourself and the ones that you take care of. Also, engage in healthy activities. I live across the street from a park, and people have been out in that park for the past couple of weeks. They finally got out, and they've been keeping some distance between each other and everything, but they've been getting out. I've been seeing people of all ages getting out, getting some fresh air, getting out in the sun when it's sunny, but still maintaining some distance and engaging in some of the good behaviors for not being infected. Getting exercise, getting adequate sleep. When you're nervous or you're sad, you don't sleep well. You may be in the bed, but you don't sleep so well. Having as healthy of a diet as possible. And I'm the last one to talk about that, but to do that, to try to maintain as healthy a routine as you possibly can. Don't overdo things that you turn towards in order to self-medicate yourself. And especially when you're alone, those become very, very, very attractive.
Joanne, can I raise my hand?
Gee.
So I love that you said routine, because one of the things I've noticed in the people in my life that are, let's say, over 75, over 80, is they've lost their routine. So they're home, they're alone, they've lost, their sleep cycles have changed, they're not getting dressed, they're showing, in my opinion, signs of, kind of mental deterioration in a way, because they've lost, a lot of it, I think, is tied to a routine.
Mm-hmm.
How would you speak to that?
I think routines, even though it gets a bad rep, the word, routines aren't a bad thing. Routines provide security for us. And whether it's a routine of seeing your family or talking to them, or a routine of going to the seniors center for lunch, or whether it's the routine of going to church, or whether it's the routine of even going to the grocery store without fear. Those things are not as accessible as they have been.
Or at all.
And
right.
It throws everybody off. We're talking about, worry about the kids because they're not going to school. Well, worry, everybody has a routine. And to not be able to go back to that routine, it's almost an undescribable way that it throws people off their mark. And a lot of times when I have a routine, I feel I have some control in my life. I don't mean to make it sound like it's all about control, but it kind of is. You feel like you have some control in your life when you have a routine. And when you lose that, and it was beyond your control to lose it, it's really hard to get your bearings, to make sense of things, and to kind of just go day to day. So yeah, do that. Do some real basic things, like make sure you have your medications. A lot of times people don't think until the last minute about needing to get medications. Well, I know from what I've experienced as a social worker working with doctors' offices, some doctors' offices are not getting around to filling people's prescriptions for weeks. So you have to think ahead of time. Make sure that you have your medicines. That's a whole part of being safe. Don't let your personal hygiene, go down the drain. Still act as if there is some life that is there, even though it is different right now. Try to stick to routines. And also a big thing is staying connected together with people. And you may have been used to seeing them at the senior center or at church or something, but with your children and grandchildren's help, hopefully you're able to have some way of keeping contact with people, whether it's through FaceTime or Skype or Zoom, where it's kind of a face-to-face thing, or whether it's on the phone. Social contact is one of the biggest factors in mental health of any age group, especially older adults.
And that is just so perfect, Joanne. And we didn't even share with you ahead of time the information that Michelle, Tammy Ward, and myself have been gathering, but it's all about trying to maintain social connections. Does that sum it up, Michelle?
I think so. Yeah, I was nodding because some of the things she said were really things we talked about. And even with Tammy, the first time I met her, this was pre-COVID. I don't think any of us thought we'd be in this position, but she really opened my eyes to, having a routine, not just for elderly, but their caregivers and people who might be burned out from
burnout.
caring for elderly. So she really just taught me a lot about the need and the community resources and just the need for dialogues, discussions like this. So yeah, I think it's a common theme, and I think for a lot of us, it's just we've kind of just been rolling with it and learning from each other and taking themes that we've seen like in just general mental health or in hospice care and sort of come together, because there's so many, this is so unfamiliar in so many ways for a lot of us.
Right. And Joanne, you may find that some of the resources that we're going to share with this group today that you know about, and you probably know much more about them than myself even. So please act as the other Joanne acts and jump in at any point.
Thank you. And I'm glad that we're all on the same page about this, because creating routines gives people a sense of purpose. It gives people a sense of control. It gives people a sense of a reason to get up in the morning. And that's what it's all about, no matter who you are. But everybody's sense of control, and everybody's routine is going to be a little bit different because we're all different. So yes. I don't mean to make it all about control, but the honest to goodness truth is that
I love control.
the people who tend to do
We
that
all do.
tend to be people who feel that they have control over the majority of their life and are able to tell the difference between what they can't control and what they can control.
And that's hard. That's hard.
That is, yeah.
Especially when you're extremely stressed. You know, I think for me, at least personally, I can only speak for myself. Sometimes when I'm under heavy stress, it's it's hard to see the forest from the trees. I hate to say that, but you know,
Mhm.
it can get blurred. Those things that I think I can control when in actuality I may not have any control over.
Sure. Or if you're physically or emotionally vulnerable, more so than the majority of the population, then being out of a routine is even tougher to reestablish when you may not have as many resources as other people have, which
Well spoken.
makes it feel out of control.
Shall we pass the baton on to Michelle?
Sure. So we kind of worked on this together, me, Joanne, and Tammy, just for the needs of resources. And I think we sort of broke them up into local resources, virtual, social, those sorts of things. So let me try to share the screen here. So we just put together, and we'll make this available to anyone who's here, who's on our list. Certainly Tammy can share this with her Elderly Services Network group, but just some mental health resources for elders and their families and caregivers. So let's see. So one thing we found was, you know, you mentioned phone support, and we were thinking and looking at trying to find like local phone buddies. And I know I looked at one, but it was for Milwaukee County, but I know a lot of people are interested in ARP or subscribe to ARP. And so I turned 50 this year and I already am getting ARP stuff. So I guess I moved up into that demographic, but they have a website for like a phone buddy. And we were talking among us, like one of the challenges is that either the senior might have to initiate this, but can you see the website? Connecting people to people?
Now we can.
Okay.
Yep.
So we'll have a web link embedded and you can look at this, but so you can have a request to have a volunteer call you. But like we mentioned, one thing I really learned from Tammy when I first met her was, you know, it's not just elderly, it's these general themes that we've talked about. So, you know, what do you do when you show up at someone's house and they're depressed? And the general audience really had questions, not just for elderly, but caregivers, you know, everyday people like me. And so we kind of put these together for friends and family. So that was one resource. And they really talked about, you know, during these times we may be isolated, but we don't have to be alone. Sometimes just hearing a friendly voice on the other end of the line can help in challenging times. ARP friendly voices are trained volunteers who provide a call to say hello. So they might form a friendship. I know a lot of people trust in that branding. So we thought that might be good. Oops. And then Joanne, you had mentioned this one. Oops, you're on mute.
I just start talking. I forget I'm on mute. I'm so sorry.
I've been doing that all the time, and sometimes my camera works and sometimes it doesn't.
So the Well Connected is an organization or a part of an organization that is all over the country, and it's part of COVIA, COVIA, which is a community for seniors, but they do so much virtually, and they have for quite a period of time, but it's just, I think, couldn't be offered at a better time right now when so many of us are quarantined. A lot of it is through Zoom meetings, and they have everything from advocacy to classes where you can learn. And one of the things that I thought I'd bring up from them that may be a great resource for seniors who are isolated at home and are looking for something to entertain or a little outside the norm that they would normally read or get involved in, is armchair travel. So it's hosted on Mondays through Well Connected, and it's very easy to sign up. And they have everything from New England to Iceland, to indigenous populations, Patagonia, and I could go on, but it is just, I think, a little bit outside the average interest level. But for those seniors who maybe are used to being more well-read and or retired active professionals, this might be something that they could do from their home and connect with other people at the same time. So that's included here. And the interesting part of it also is you only have to be 60 or above. So it's, you don't have to be in your 80s.
In addition to that, for something more local, the Aging and Disability Resource Centers a lot of times are a clearinghouse for things. And I know that both the ones in Racine County and Kenosha County have telephone support groups. They've had them before, but they're really trying to emphasize them now. And
do you know where the link to that is, Joanne? Because I could not locate it to share with this group.
Absolutely, only because it's an easy place to find. It's ADRC dot, like Racine County, all one word.
Oh, I've been to their website. I couldn't find the telephone support groups.
It's under caregiver support.
There you go.
And they have them 2 times a week right now. I've had a couple of families, home hospice families, where the caregiver calls in on that. I know that some of us, people like me who do caregiver support groups, we were doing them in person. We're having to convert to Zoom, and it'll be interesting to see what it actually looks like once we finally get it pieced together. But yeah, there's caregiver support resources for either ADRC Kenosha County or Racine County. They both can let you know, and these are ones that people don't even have to leave. They don't have to know their computer. All they have to know is the telephone numbers to call. For those who are caring for somebody with any of the dementias, the Alzheimer's Association has a great deal of information to help people now, because they are trying to convert things to the telephone instead of having to have support groups, which in my opinion is probably more realistic for most caregivers anyway.
Exactly. And we have a couple resources coming up that are a lot of telephone based. And I'm glad that you tapped into the caregiver support, because I have to tell you, I kind of had my blinders on, Michelle, when we first started talking, because I was thinking about the actual older individual living alone.
Yeah, me too. And in fact, Tammy, you logged in right at the perfect time, because I was kind of singing your praises. My eyes were sort of open too. I mean, I remember, Tammy, when we first met and asked me and someone from NAMI in Kenosha to come and talk about elder care. And my first thought was, well, we don't really work with elderly. But then the more we talked about it, it was elderly caregivers. It was, you know, people my generation who are raising kids and also taking care of elderly parents. So we would say something like, you know, depression in the elderly, and then some people would say, no, I'm not elderly, but I'm having some of those too. So what do you do if you go to someone's house and they say, I'm so depressed? What do you? And so it's like, it really opened my eyes to, you know, caring for the elderly. It seems just also means caring for the whole family and the caregivers. And
Absolutely.
so and it was such a great lesson to learn from you all and from Tammy, because I was at my job for like 3 weeks. So what the heck did I know? I was still learning everybody's names. So I'm glad we could all kind of come together again tonight, even now that we're in the midst of COVID. And we see kind of these same themes again in the networking. So thanks. So this PDF here is the same as what we just shared. So it's just embedded in case you want to look at it later too. So then did you have more to say, Joanne?
No, I just moved closer to the screen so I can see it better. Sorry.
No, sometimes I talk and then but so one of the virtual online resources we talked about was the Elders Action Network. So this one, let me open this site. They have also some very basic Zoom instructions for more elderly people, but they also have just a ton of stuff for elders, for caregivers. And if you scroll down, they talk about social activism. They talk about here book study, workshops, just regular kind of buddy-to-buddy conversations. They talk about advocacy. So I really see like my parents' generation, the baby boomer, that really planted the seeds and gave us the shoulders to climb on to talk about a lot of these social justice pieces. And then some of the elder action circles, they go through national events. And so we thought that might be a good link for elders and their families. One thing that was on Facebook was, again, ARP had some virtual movie nights. So I'm not logged into Facebook right now, but I can show you.
I am, Michelle.
You are? Okay.
And on May 29th, they are having a movie night called Jump Shot, the Kenny Sailor story. And there's actually some of these, there's a huge amount of people registered to actually watch them.
Yeah.
The one that held on May 1st, the movie held on May 1st, was Care to Laugh, and it was attended by almost 11,000 guests. So it's very popular. Oh, there you go. You have it up.
Okay,
And it truly looks wonderful. Not obviously people have to have a Facebook access, right, to get to this information.
But yeah, but even this, I even thought kind of our theme. So if someone was going over to see an elderly parent who lives alone or a grandparent, and they say they don't have anything to do, maybe people our generation or our kids or our adult kids, maybe they have Facebook and they can kind of hook them up and show them how to do that. But yeah, I thought that too. I don't know much about the movie that's showing, but yeah, there were lots of guests and
yeah, it's well attended, which is wonderful.
I think so too. Yeah, you can fiddle with that if you have anything to add since you're on Facebook there.
I was just reading Tammy's chat.
Oh,
did you see it, Michelle?
Yeah, I think I said hi, welcome.
It looks like she's got to leave to go back to the office to reset.
Oh gosh, yeah.
Yeah.
Yeah, no worries. I mean,
one group that a lot of times isn't discussed when we talk about resources for older adults is for people in the LGBT community. And they're at a much greater likelihood of being alone, not having family to support them.
Right.
There is actually a group, an organization. It operates out of Milwaukee, but it covers this area, southeastern Wisconsin, called SAGE, S-A-G-E.
Oh.
And you can find them under sageusa.org.
I'll put that on here.
That'll bring you to their website.
Thank you.
It's a very, I mean, I know just from in Racine and Kenosha, there are more LGBT elders than people know.
Right.
And so it's a group that to bring that information, I think, is really important just to have it there.
Right.
Here, I added it in impromptu.
That's how interactive this time of life is.
Okay, so I can move forward and let's see. Oh, Joanne, do you want to talk about this one?
The Caregivers Resource Guide.
Yeah.
It's another terrific piece that ARP puts out. One of the things, Michelle, a question for you, because I truly don't know the answer to this, but are these resources through ARP available to people who are not ARPers?
Let me see.
Some yes, some no, isn't it?
Okay. Because here, this page highlights family caregiving.
Okay.
And so there's, you can see they have support lines and groups here. But I don't know, Joanne Brown, do you know specifically which ones are or aren't?
I'm trying to think. Off the top of my head, I'm thinking the supplemental insurance for ARP. You have to be a member of ARP in order to be able to get it, because it's
Okay.
very, very good from what I hear. But in terms of some of the other things, I think they do as kind of a recruitment activity sometimes, but I'm not completely sure which ones are and are not.
It's interesting, Joanne, that you say that, because as you were talking, I went to their site under Community Connections, and I just tapped on a section they had called Mental Health. And, everything from an online discussion to hear from a friendly voice, personalized grief support all year long, meditation, reflection, and bedtime stories, guided meditations. I had no idea this amount of resources was available on the ARP site. So once again, the fact that we are gathering to share this information and obviously learn from each other and learn as we go, we can build quite a resource library for individuals.
Yeah, I think so too. And we could even, start with this little one, and maybe next year we'll meet again and have more, or have people from our networks contribute more. I mean, we added some impromptu right now, and yeah, just think of what we could do if everybody has one or knows someone who could benefit, and then they give us feedback and
Yeah, have their experiences be shared. Wouldn't that be outstanding?
wouldn't it? Yeah.
Mm-hmm.
Mhm.
That would be wonderful because, just like any topic or any person or surrounding mental health or, whatever it may be, is important to keep sharing. All this is important to keep sharing and pulling our resources, because some nonprofits in the area are pretty good about collaborating and working together, but I always just feel like there's always more we can be doing, and obviously we don't want people to get burnt out or struggle, but it needs to be shared more and more, because I feel like a lot of this stuff, not just mental illness itself, but even this kind of stuff with seniors, or in the other panels when we talked about peers or children, is still so stigmatized and
Yes.
nobody and uncomfortable. And of course, it's understandable to be uncomfortable, but we have to talk about it, because then it's just not going to get better. So I appreciate you ladies for all that you are doing and continue to do, because we need it.
And Michelle, I'll speak for Tammy. The Elderly Services Network that she runs, that meets on a monthly basis, the information you've pulled together here and the resources you have would be a great addition to that group, if you can find time in your busy schedule to join us, because I could see that, that we could help contribute resources and vice versa.
Right, yeah, that would be great. I know I went to the first one, which was, I think, in February, right after I started. And then I didn't know what happened after COVID, but Tammy and I kind of stayed in touch on emails. But I think this, as busy as it feels, especially being new and all these twists and turns, is it's almost a form of self-care when we know we have to do the work. And like, I remember when I started, it's like rebuilding or building new partnerships was really at the top of the strategic plan of NAMI. And it's like, people kept telling me, pace yourself, because I was like, oh yeah, I remember that person. But it feels like the more we talk, the more connections we make. So
Sure.
with you here from Hospice Alliance and Aaron's here and Tammy from Elderly and us from NAMI, it's like all these people meet and it's just one meeting. So it feels more efficient, but it's still, and it feels like more powerful, but we're still doing the work. So I'm really grateful for Tammy and for you guys for just kind of teaching me early on just the power of collective and starting something and growing and that. So yeah, if I'll send Tammy these PowerPoints and then I'll ask her, you know, if she has any additions or if I can come back or bring
Oh,
others
sure.
from NAMI might be helpful. But
Yes, and I think having you highlight one of the ESN meetings would, because you know she likes guest speakers, which
Yeah.
are always very powerful,
Yeah.
would be great. And then because there's so much information, then we barely, you know, tap the surface of it tonight. But we're working on pulling this all together, which is outstanding.
Yeah.
That's not a critique; it's a jumping off point.
Oh yeah. Yeah.
I would like to see how we could pull our minds together as far as creating a larger audience
Mhm.
for this information, because Joanne, I'm going to throw you under the bus here, but I know Joanne knows how much how great the need is
Yeah.
out there. Is that right, Joanne?
Sure. I mean, I'm looking at the time right now and it's 20 till 7. And assuming that you're just caring for an older person, like a parent or whatever, and you're not in that sandwich generation where you're taking care of the teens as well as the parents, 20 till 7 is a very busy time.
Mhm.
Getting ready to get ready for bed, getting all your stuff in order, getting into that ritual that everybody needs before bedtime to relax and things like that. Sometimes it's things that we don't even think of until we start thinking about the people. Who do we want to hear this? And if it's that we want caregivers to hear this, then it helps if it's at a time that's more convenient for them. But for every caregiver, there's a different convenient time. I mean,
Yeah.
it's hard to, it's really hard to point out what would be best in that. But oh yeah, the need in the caregivers is just something incredible, because we have a lot of patients that are in facilities, and all the facilities now are on lockdown because of the COVID pandemic. And so since we can't contact them, we contact the family members on a regular basis to check in. And you know, caregivers are pretty darn creative. They were the ones that initiated the window visits. They're the ones that have initiated all sorts of different things to try to maintain contact with their loved ones that are in facilities. But that separation, we've even had people who their loved one has passed away and they weren't able to be there at the time of their passing. So, I mean, there's always that underlying fear. Someone told me the other day, I know my mother has the end-stage Alzheimer's. I know that it will probably be some kind of bug that will eventually, you know, take her life. But I don't know if, is it COVID? Is it going to be something else or whatever? And so while all this is going on, she's thinking, is there ever going to be another time I'm going to get to see my mother again? So that's additional stress on her on top of everything else. But then everybody also understands why they're doing what they're doing.
Right.
So can I share something with you guys real quick?
Sure.
My mom is struggling with dealing with her elderly father right now. He's 87 and he like doesn't want anyone's help. He refuses to like allow her to help with finances. And the thing is he's got a long history of Alzheimer's in his family. We can see it coming, you know, if it's not already there. And he won't even allow any of us to become like a power of attorney or anything for him for when something does happen and he can't make his own decisions. So she's been having a really hard time finding resources to help her with him. So I don't know like where she should maybe look, or
when you say resources for him, what are you looking for? What do you?
I almost feel like she needs like a mediator with him, like because she's all he has. You know, like nobody else is there to take care of him but her. And he's so resistant to all of it. He's had 2 accidents in his house where he fell and hurt himself really bad and ended up in the hospital. He refuses to wear a life alert. He refuses to leave his home. You know, he won't give up his driver's license.
Oh, yeah.
Yeah, I mean, it's just.
Has he
Oops,
done an
sorry.
advance directive of a power of attorney document?
I'm sorry, what was that?
Has he done a power of attorney document yet for healthcare?
I believe my mother is for healthcare.
Okay. Just because that's good to have in place ahead of time if at all possible. But I mean, he's in a real gray area because the state believes that people have the right to make bad decisions for themselves. And so they have a lot of, their continuum of what is they are consider acceptable is quite broad.
Right.
If there's a fear that he's a danger to himself or to someone else, then obviously you could, if worse came to worse, you could involve, you know, adult protective services, but that's a worst case scenario.
Right.
I guess it would depend on how much your mother is wanting to get involved in his caretaking.
I mean, she really just wants to make sure that he's safe and that when that time comes, that the T's are crossed and the I's are dotted, you know, like she's not trying to take control of his life or his assets or anything like that. She just wants to make sure that those safety nets are there.
One of a new type of person that's coming out, I'd say in the past few years, has been the professional geriatric case manager. And these are people who, they kind of have their company, and they act as a care manager for that person. They don't have
Okay.
any real legal say over them like a spouse would, but they're able to sometimes come in as a disinterested third party and talk to the family and help the family to make arrangements, whether it's getting paid caregivers, whether it's being evaluated for potential placement outside the home or whatever. They can come in and do that. They're pretty much, I believe they're fee for service for most of them, so you would have a variation in price. But there are professional geriatric case managers now in Racine and Kenosha.
Okay.
That could.
And Joanne, how does Nicole find those? Just search on geriatric case manager?
Geez, that's I tell you to get in the yellow pages. That's old timey, isn't it? Aging and I believe that Aging and Disability Resources could give you some
I bet
guidance.
it's in their directory.
It is in the
resources.
directory.
Yeah.
Actually, it is. There's a special part for case managers.
You know what? And I have that directory at work, so I should probably whip that out for her.
Yes, and
Yeah.
there are several, and they seem to be doing quite well for all of it, for all the competition, which has grown up in the past few years. They seem to be doing quite well. I've worked with a lot of people that use them and have been quite pleased. So.
Okay.
Plus, Nicole, I love the idea of an uninterested third party.
Yes.
You know, to someone who's neutral. They won't take mom's side. They won't take your grandpa's
Right.
side. You know, that sounds great.
And I think that's almost like they need almost like a mediator or something
And
between the
that's
two
the
of
best
them.
that's the best you're gonna get, because you want someone, a mediator who knows what the scoop is.
Right.
And so that, yeah, it's a place to start.
Yes. No, definitely. Thank you.
Sure.
Yeah, great. Thanks for sharing. Let's see. Okay, let me go back into here. So I don't know that much about this resource, but maybe one of the Joannes or Nicole and Allison, but there's a place in Racine that you can call called Comfort Keepers.
Yes.
I'll
Yeah.
just have you, okay.
They
You want
and
to a little more about it?
Sure. You're referring to me, right? I'm sorry, because I don't have the Zoom up right now. I have the website for Comfort Keepers. So the reason I added this to our resource file is because they have a PDF all about coronavirus resources for care. It includes AARP and the Alzheimer's Association, the National Council on Aging, United Way, Feeding America, Serving Seniors, WebMD, Walgreens, CVS, a way to get your prescriptions less expensive. It even goes into things like DoorDash and Uber Eats and Postmates Freshly, as far as making sure that groceries are delivered or food is delivered, meal kits for seniors. So it's just an amazing amount of resources on this particular site.
Yeah, they're a caregiver agency.
Exactly. And these resources, anyone can access this. It's, it's out there, it's free. And they even have information out here to help people learn how to use FaceTime and Skype and Zoom and Facebook, which I think, is something nice to have in your back pocket. And then they talk about national parks and tours like we had talked about before. And Michelle, when I was initially looking at that, I thought, this might be a good time to plug Hospice Alliance and our part of our website that's called Until Next Time. So as Joanne Brown mentioned a little while ago, that there are a number of facilities that our caregivers and our music therapists, yeah, there you go. Perfect.
Can you see this?
Are unable to actually get into right now. Our music therapists recorded sing-alongs and great ways to entertain people with music. And then as you scroll down on that page, we actually have a number of links right there for various different topics. So if someone is at home and they're isolated, sending them this information as well as some of the others that we've already contacted helps create activities.
Oh, great.
So that's my very
Thanks.
unhumble plug.
A little selfless, what is it? Shameless self-promotion never
There you
hurts.
go.
There you go.
Yeah.
Shameless self-promotion. I gotta have to remember that.
That's not I don't know where I heard it, but.
That's okay. You're sharing. It's all good.
Yep. So, yeah. So
Shameless plug. People
Thanks
Yeah.
for
do that
sharing.
too.
Yeah. So, oh, well, speaking of shameless self-promotion.
See, timing is perfect. Everything is as it should be.
You might have heard of a little place called Navi. So our website is there. Most of us have seen it, but the main thing, and again, I have to give credit really to Tammy and also Nicole and Allison. When I first went to talk with Elderly Services Network, in my mind, I didn't see the connection between NAMI and what we had to offer for elders, but we really had sort of this little kind of impromptu team that came together, and it really opened my eyes. I know when I went and talked with ESN, she said, oh, it'll be an hour, and I thought, I didn't think I would have enough. They fed us really well, so I thought maybe everyone would just eat really slowly. But we went over. We ended up talking for about an hour and 15 minutes, just my little spiel, and then the Q&A was just so interactive because I think family support and peer support, people really want to know who our elders, who caregivers are, and especially now in COVID, people like healthcare professionals caring for the elderly who are seeing them, die in their care or get worse, and the families call and are just, like you mentioned, distraught because they can't talk to them. So it's really, I always thought and was kind of trained that mental health is everywhere, and it seems like, elder care affects all of us in one way or another, and this sort of opened my eyes to caring for families as well. So we put some information about our website and registration information for groups. And they're open to the public and free and all of that. So anyone who needs that for any reason, we want to make sure we're reaching everybody that we can.
Do people have to register for your virtual peer support groups, Michelle?
Yeah, we put the links here because it's actually kind of a best practices policy from NAMI National and NAMI Wisconsin. So we're on their Zoom account. And it's just to make sure because, you know, if someone hacks in, and
Right.
if someone,
No,
you know, if someone's
yeah, there's HIPAA
lurking,
issues, no
right,
doubt.
and
Right.
apparently there have been issues in the past, like someone will post like, I don't want to be crude, but they've posted like porn. And then
Yeah.
people in the group maybe have history of trauma or, you know, and they see that. So it can trigger. And then what do you do as the peer leader who sees the person triggered, and can they sue for?
Yeah,
So,
no, it
yeah,
gets
so
very
that's,
complicated.
yeah. So
Yeah, we just found that out.
yeah,
The
so,
caregiver support groups
Right.
preparing for them, yes.
yeah. So there's some background there, but yeah, NAMI National does ask us to register people. And I mean, it's painless. You send it, it's just like tonight, we send you the Zoom link and
Right. We are doing that now too for all of our Zoom meetings
yeah,
that we hold with our facilities.
right.
You know, change is hard. There's no doubt
Yeah.
about it. So we're
And it's
finding we're changing processes and
right, us
we'll
too.
learn.
And it just like, I always thought very little surprised me, but we have like NAMI affiliate meetings every month or every other week now, and hearing some of our affiliates who said, you know, we didn't think we could register because people in town know us, and then
Right.
someone comes in and intentionally causes harm, and it's like my jaw just dropped, and it's like, I guess you can't be too careful, but it's painless, and we make it as painless as possible. So
Right. Well,
um,
and I think people appreciate that you go that extra yard to ensure their privacy.
yeah,
As Racine County Board virtual thing, somebody porn bombed
yeah,
them, and they had to stop. So
right. Yeah, someone did it during just an open Facebook group doing like prayer and rosary in the afternoon. Someone came in. It's like, it's like you want to be trusting, but
I
there
don't
are
understand people
processes.
sometimes.
Right. Right.
It's just
So,
irresponsible and just like,
yeah.
why? What are you bored? Like, what?
No, it's because there is plenty of different types of mental illness in the world.
Yeah,
it's because
no,
they
that's
it's
true.
because they can,
Right.
Yeah,
because they
Yeah.
can,
Right.
not whether it's right or not.
yeah,
Yeah.
Right.
They get some
Yeah.
sort of weird thrill. It's just crazy.
Mhm.
yeah.
But
Agree.
Sorry.
one of the things, Michelle, that just went through my head, something that we had all discussed earlier as far as audience and the reach and the number of people who in different groups that could actually benefit from this type of information or this type of gathering. And it hit me as, you know, a bad idea for us to maybe look at in the future is a recorded webinar type of thing of this concept, this information that then people could, and I think maybe Joanne, the concept you said about when's a good time for different people in different lives, right? We just don't know. That it would be something that maybe they can access off of your site or other sites, you know, to have access to that information. I don't know,
Yeah.
bad idea, tuck it away in your
It's,
folder of ideas and
Yeah.
we'll see what comes out of it.
I think Nicole, you had some ideas about that before, right? Webinars and putting stuff together and
Yeah, Zoom actually has a webinar feature and it records it for you if you want it recorded.
Yeah.
And then you can upload that file to, yeah, put on your website or share via Facebook or any of those avenues.
Yeah, a lot of people have been doing that, especially,
Yeah.
you know, before, but even during this time. I mean, because again, you don't know people's time for stuff. So,
Right.
no, I think it's a good idea. I know we've discussed it for other things, or, you know, when we've talked with other organizations, we talked about doing webinars and things like that. So, well, again, now I think it's a good resource to rely on because things are still so up in the air, right? So, no, I think it's a very good idea. I think we'd be excited to do something like that potentially.
And the demographic of the help that's needed right now is, you know, if we're talking the caregivers and elderly, and I know mental illness covers a lot more than just elderly, but as far as that particular vulnerable population, to me, seems like it's going to be under safer at home orders or whatever you want to call it, more of a quarantine isolation environment longer than a lot of the other areas of the population.
I think so too, because I mean, no, well, even I know some places like my great aunt who lives in Iowa lives, at like a residential, like retirement kind of facility. And she was able to have people come, to the window, but now they can't even do that because if you have the window open, even if you're wearing a mask, and it's just, which is
Right.
hard. And we can still call her and things like that. But it's just, it's hard because they are so vulnerable. I mean, everybody is, but especially people like that are so vulnerable. So anything we can, because I think
And
about
I
her all the time.
And I think about retired individuals living in a senior apartment or even their own apartment or their own home. And maybe they don't have a large extended family or they don't live nearby. And, what is their support network look like right now?
I think about that all the time.
Yeah, me too.
How do we reach them? That I don't know either.
Yeah.
Whether it's things like this, social media, or whatever we can do, sending things through the mail or something. We got to reach them somehow. So
Well, and sadly, the responsibility then goes to them to have to reach out rather than us reaching in, so to speak. But
Correct.
and that in itself, a lot of people over the age of stage that that's not what they do. They don't.
No.
That's being
Their problems are their problems. They don't want to let anybody else know that they might have a need. Right?
Yeah, they keep things
It's hard.
kind of under the rug sometimes.
And I was telling Michelle a little earlier during our practice session that I'm a buddy at my congregation. So one of the things we've done, and I don't know how to do this, the population at large, but is for those people who are more shut-ins, I guess, who don't get out, or maybe they don't drive or what have you, we've assigned them to someone as a buddy to call them once a week. So all the people who volunteer for buddies get, 2 names to call. And gosh, in the last 4 or 5 weeks, we've become friends.
That's
That's
awesome.
neat.
That's so great. I wish more places were able to or willing to do that. I know my parents' church, they were kind of not necessarily just seniors, but calling different people in the congregation just to check in. But I think especially now more than ever, that's very important. That's incredible that you're doing
But I don't know that it's something that you could, I don't know how you would roll that concept out to the population. I think once again, it has to be initiated by the individual, and then we run over those same stumbling blocks that you mentioned, Joanne.
Yeah.
Yeah, Michelle, it did look like it got dark in there. I don't know if
I know the sun
power
was
went
coming
off
through
or.
the window. The sun was coming through the window and then it sort of disappeared.
Yeah.
And I thought, well, maybe it's nap time because it could be nap time for me.
Well, it is 7, so I don't know. I mean, obviously, if there's more things we want to discuss, that's fine. I just, I was just keeping an eye on it.
Thank you for
is there
doing
anything
so.
else?
Thanks.
Any questions? I mean, I know it's just us here, but any questions for us? Anything else you want to share? Anything else you want to discuss?
Well, if
So what do you
Michelle,
do tomorrow?
Michelle, if you're interested in trying to take this further and, get it sewn up a little bit as far as the presentation of it,